Today's drug is ibuprofen. Common brand names are Advil and Motrin. The therapeutic category is that it's an analgesic, a non-opioid. It's also commonly known as a non-steroidal anti-inflammatory drug, or NSAID. There are various indications. Some of the prescription indications are for inflammatory disease, rheumatoid disorders, mild to moderate pain, reduction of fever, and for patent ductus arteriosus. There are various over-the-counter indications as well, such as reduction of fever, management of pain due to headache and migraines, sore throat, arthritis, physical sprains and strains, menstrual pain, dental pain, minor muscle, bone, and joint pain, backaches, and cold and flu pain. Some off-label uses is for acute gout flares and pericarditis. Dosage form and strength. The medication comes in a capsule. There are multiple types, such as liquid gels as well as the regular capsule. That strength comes in a 200 milligram strength. The next dosage form is for the tablet. It also comes in multiple types, such as dye-free and chewable. The over-the-counter strength is 200 milligrams, with 400 and 600 and 800 milligrams being prescription only. Another dosage form is suspensions. There are multiple types, such as alcohol-free or dye-free, as well as coming in a variety of flavors. The children's suspension is 100 milligrams per 5 milliliters, while the infant suspension is 50 milligrams per 1.25 milliliters. There is also a solution that is for intravenous use, and that comes in a 10 milligram per milliliter strength. Dosage form and strength. Dosing by indication. Dosing for mild to moderate pain for adults, or dosing for analgesia for adults. Initiate 2 to 800 milligrams by mouth 3 to 4 times daily. The typical dose is 400 milligrams with 1200 to 2400 milligrams per day. The max dose is 3200 milligrams per day. The American Pain Society suggests 200 to 400 milligrams by mouth every 4 to 6 hours with a max of 3200 milligrams per day. An alternative dosing is IV. The dosing is 400 to 800 milligrams parenterally every 6 hours as needed with a max of 3,200 milligrams per day. Dosing for antipyretic effects for adults. When using IV dosage forms, initiate 400 milligrams every 4 to 6 hours or 100 to 200 milligrams every 4 hours as needed with a max of 3,200 milligrams per day. Dosing for painful periods or menstrual cramps and pains in adolescents to adult females. Initiate between 200 and 800 milligrams by mouth 3 to 4 times daily. A typical dose is between 1200 and 2400 milligrams per day with a max duration between 3 to 5 days. Dosing for osteoarthritis or rheumatoid arthritis in adults. The dose is between 400 and 800 milligrams by mouth 3 to 4 times daily with a max of 3,200 milligrams per day. Dosing for acute gout flares, 800 milligrams by mouth 3 times daily, initiated within 24 to 48 hours of flare onset for 5 to 7 days. Discontinue therapy 2 to 3 days after gout resolution. Another off-label use is dosing for pericarditis. Initiate 600 milligrams every 8 hours for 7 to 14 days if acute, and a max of 1200 to 1400 milligrams if recurrent, with decreasing taper by 200 to 400 milligrams every 1 to 2 weeks. Dosing for analgesic effects in pediatrics. The weight-based dose is typically between 4 to 10 milligrams per kilogram per day, or fixed dosing based on a weight chart, and the dose is repeated every 6 to 8 hours with a max of 4 doses per day. Dosing for fever or antipyretic effects in pediatrics. In children less than or equal to 6 months of age, as well as in children and adolescents, the weight-based dosing is 5 to 10 milligrams per kilogram per dose every 6 to 8 hours, with a max dose of 400 milligrams. And the max daily dose is 40 milligrams per kilogram per day for up to 1,200 milligrams per day. For children 6 months to 11 years of age, a good rule of thumb is that 5 to 10 milligrams per kilogram per dose every 6 to 8 hours, with a max of 4 daily doses. Children that are greater than or equal to 12 years of age up to adolescence, 200 milligrams by mouth every 4 to 6 hours as needed for up to 3 days. If that pain persists or if the fever persists, you can increase to 400 milligrams with a max dose of 1,200 milligrams per day. Mechanism of action and pharmacology. Ibuprofen reversibly inhibits cyclooxygenase 1 and 2 enzymes. This inhibition decreases the formation of prostaglandin precursors. Ibuprofen has multiple benefits, such as being an antipyretic, analgesic, and anti-inflammatory. Additional anti-inflammatory mechanisms may be attributed to neutrophil aggregation and activation, which decreases cytokine levels. This is important because cytokines are pro-inflammatory. There is also an inhibition of chemotaxis and the alteration of lymphocyte activity. The absorption of the medication is rapid at 85%. The metabolism is hepatic through oxidation. Regarding excretion, between 45 and 80% is excreted in the urine, with fecal excretion to a lesser extent. The onset of action. The analgesic effect usually occurs between 30 and 60 minutes, while the antipyretic effect is seen within 1 to 2 hours. There is high variability based on the age of the patient, and the max effect of the antipyretic effect is usually seen between 2 to 4 hours. Time to peak for the tablets are between 1 to 2 hours. The suspension has a median of around 30 minutes. Chewable tablets have a median of about 1.5 hours. The duration of action for ibuprofen. For the antipyretic effects, it lasts about 6 to 8 hours. The half-life elimination in pediatrics is around 1.5 hours, while adults is 2.5 hours. And ibuprofen is highly protein-bound with greater than 90%. Special populations and considerations. Severe hypersensitivity reactions, such as serious skin reactions, is a concern. The geriatric dosing may require lower end of dosing compared to adults. Use of NSAIDs chronically in women may be associated with reversible infertility. Conflicting data for birth defects. Suggested avoidance starting at 30 weeks gestation. NSAID use close to conception may be associated with increased miscarriage risk. Side effects. GI bleeding, upset stomach, nausea, vomiting, diarrhea, headache, constipation, and dizziness. There is a U.S. boxed warning for serious cardiovascular thrombic events. NSAIDs cause increased risk of serious cardiovascular thrombotic events, such as MI and stroke. There is an increased risk for serious GI bleed, ulcerations, and perforations. Drug interactions. Drugs with antiplatelet properties, such as other NSAIDs like naproxen and meloxicam, as well as with agents such as SSRIs and clopidogrel. Alcohol may increase adverse toxic effects of NSAIDs, such as GI bleed. ACE inhibitors may enhance adverse toxic effects of NSAIDs, as well as NSAIDs may decrease ACE inhibitors' efficacy. Monitoring parameters. Bleeding and bruising, rash, itching and swelling, weight gain, liver problems, so watch for dark urine. Patient counseling information. This medication is used to ease pain, swelling, fever, and arthritis, and take medication with food to avoid stomach upset.